I now have the pleasure the great honor really, to introduce you to Katie Brandt. I've been so excited and looking forward to her presentation. Katie is the Director of Caregiver Support Services and Public Relations at Frontotemporal Dementia Orders Unit in Mass General. I heard her speak this summer and I was so moved, and I know you will be today. She advocates for caregivers nationally through her co-chair role on the National Alzheimer's Product Act, NAPA, Advisory Council on Alzheimer's Research, Care and Services. And she was a caregiver for her husband who passed away from frontotemporal dementia, and currently caring for her father who's living with Alzheimer's disease. So Katie, I'm looking forward to hearing you. Thank you so much for being part of the symposium today.
Oh, Carol, thank you. I'm so thrilled to be here. And is everyone able to hear me? Wonderful. Okay, I'm going to share my screen. So, yeah. It's always a little bit of a dance. Let's see. Okay, there we go. How is that looking? Can everyone see that?
Looks great, Katie.
Awesome, thank you. Hello, everyone. Thank you so much for having me today. My talk is going to be about resiliency, strength, and support, things that we all need every day, especially living in pandemic, but I think that caregivers need especially. Carol's introduction, of course, all those things about me are true. I'm the Director of Caregiver Support Services and Public Relations in the MGH Frontal Temporal Disorders Unit. We're a specialty unit within the neurology department at Mass General Hospital. And I'm so honored to sit as co-chair of the National Alzheimer's Project Act Advisory Council. And the thing that I think is special about that position is that I sit in the caregiver seat. So I'm not just there representing our Alzheimer's and related dementia community, but specifically the perspective of care partners, which I think is so incredibly important. I'm the co-facilitator of the Boston area FTD support group. And I realized that throughout my years in the dementia community, I've attended over 150 caregiver support groups. So it's really given me not only strength and support, but the ability to listen and really hear the perspectives of others. If you want to learn more about our clinical research program, you can go to ftd-boston.org. But the thing that I really wanted to highlight here is that my position as the Director of Caregiver Support Services highlights the importance of an interdisciplinary team approach. And that's because our director, Dr. Brad Dickerson, recognizes that all the care needed for those individuals living with Alzheimer's and related dementia doesn't just happen in clinic. You need a team of people to help care for not only the individuals living with the diagnosis, but families impacted. So all of those professional titles aside, the real reason that I'm here today is to share my personal story, the heart of my connection with our community. Here's a picture of my husband, Mike, and I on our wedding day. I remember our first date. He picked me up at my college dorm. He had a backpack with a blanket, some big red party cups, and a half full bottle of red wine. And we went out to walk and look at the stars on the campus soccer field at night. We talked for hours and had such a good time. And even though that night was heavy with the promise of romance, when my roommates were asking me for all the details, I had to be honest and tell them that Mike was too shy to even hold my hand on the walk back to the dorms. But we got married at the age of 22. We had an old Buick that my parents had given us and some extra furniture from my grandmother's house to furnish our one-bedroom apartment. And we set off to build our lives together. 5 years later, we both earned our graduate degrees. Our jobs had turned into careers, and we realized that the love we had for each other was just too big for just two people. And so here I am, pregnant with our son Noah, and I promise that all the pictures in my slideshow are not of Mike and I kissing, but just, just the first couple. You know, Mike always loved this picture. He said, throughout my entire pregnancy, my stomach never got bigger than his. And I would just really remind him that that was not something to be proud of, but he really got a kick out of it. So really for us, this was kind of having it all. We had meaningful work. We settled into a lovely little home in a lake community in New Hampshire. I mean, Noah's a dream. This is our first family picture at home, the day we came home from the hospital. And then there's Noah learning to walk. And it seemed like this was everything that we'd worked for. But suddenly things were not quite right. You know, Mike was a really outgoing guy with so many friends. And suddenly I was finding that he was a bit withdrawn. I started getting phone calls from friends saying that Mike didn't want to talk to them. He wasn't taking their phone calls. I myself was noticing normally when we get home from work, we just talk while we cook dinner, we talk for hours. Sometimes we wouldn't even watch TV or do anything else. And I noticed that he wasn't as interested in engaging in conversation. I started noticing he was having trouble writing. This was a man who had graduated with honors from his bachelor's and his master's degree. He used to be able to translate texts from Hebrew, Greek, and Latin because he was a philosophy student. And suddenly he couldn't spell the word rice or avocado when we were making a grocery list. Unable to follow social norms or rules at work, he kept getting in trouble for not wearing a tie, which was part of the dress code in his job as a theology teacher at a private Catholic high school. And when I said to him, "Why won't you just wear your tie?" he said, "I don't want to wear a tie at work," which really did not seem a good enough reason to jeopardize employment, especially as a new dad. He had a lot of impulsive behavior and compulsive behavior. So impulsive would be things that he would do sort of without thinking right away. I casually mentioned maybe we should paint the baby's room. And so he walked upstairs and ripped a big hunk of wallpaper off the wall. Compulsive walking and eating. He became obsessed with fire at a certain time. So a lot of really strange behaviors that I wasn't quite sure how to deal with. So I started taking Mike to the doctor. I went with him to his annual primary care appointment, and I said to the physician, "My husband is acting so weird. Does he have a brain tumor?" And she was the first of 8 medical and mental health professionals to misdiagnose him. Mike saw 2 primary care physicians, 3 counselors, 2 psychiatrists, and 1 neurologist. He stayed overnight at the hospital and spent a week in a secure psychiatric unit, and he had many tests. But it wasn't until I took him to Boston to see the director of cognitive neurology at Beth Israel that he received the accurate diagnosis of behavioral variant frontotemporal dementia at the age of 29. So for those of you who are unfamiliar, I'm not a physician, I'm not a doctor, but just to give you a little bit of explanation of what is FTD? Why is it different from Alzheimer's disease? So when we think of frontotemporal dementia, you think of the front of the brain, the frontal lobes and the temporal lobes. So the executive functioning, the things that make you, your personality, the way that you understand the world and fit into society, a lot of that happens in your frontal lobe. And then the temporal lobes are in charge of language and communication. Alzheimer's disease tends to start in the back of the brain. And that's why we see a lot of challenges with memory first, but individuals' personality, their character, the things that make them them may stay intact for a very long time. Some fast facts about FTD. It's the most prevalent dementia. It's the most prevalent young onset dementia. It's considered a related dementia to Alzheimer's disease, and the average age of onset is 57. Of course, Mike was such an outlier, being diagnosed so young at 29. And what we know is that it affects an estimated 50 to 60,000 individuals in the United States. That number may in fact be much lower than reality because FTD can be difficult to diagnose. Many of those early symptoms that Mike had folks can often be diagnosed with mental health disorders, which is what Mike was diagnosed with. And what will happen is individuals will receive those mental health disorders, but continue to worsen over time. And so individuals with frontotemporal dementia may not, in fact, see a neurologist until they're at moderate stage. So they'll often miss out on diagnosis in the early or mild stage, which may be a time where they can really participate in conversations or care planning with loved ones. The disease may last 2 to 20 years. Again, that really depends on when someone is diagnosed. And an important point here to think about is there was a study done by the Association for Frontotemporal Degeneration, led by Dr. Jim Galvin, and you can read more about it if you go to their website. It was published in the Journal of Neurology in 2017, where they noted that the cost of FTD care can be twice as much as the cost of caring for someone living with Alzheimer's disease, $120,000 a year versus around $64,000. And that's really related to that young onset of the onset of symptoms, because folks need care while their care partner may still be fully working. And so the level of support and care that you need is much greater. Around the same time that my husband, Mike, was experiencing these signs and symptoms, my mother was telling me, and I was seeing some changes with my dad. He was incredibly forgetful, had some trouble at work where he'd made mistakes as a front-end retail manager at Costco. He got lost on the way to my sister's house for dinner one night. He dropped my mom off at the bank and then forgot she was there and just went home. And so Dad started going to the neurologist. Unexpectedly, 4 days after my husband's diagnosis of FTD, my mother passed away unexpectedly from a heart attack. And then just 17 days after she passed away, my dad was diagnosed with Alzheimer's disease at the age of 59. So at the age of 29, I found myself as a caregiver for 2 adult men with progressive neurological disorders that were likely to cause dementia, frontotemporal degeneration, and Alzheimer's disease. And I was also a mom to an infant son. You really, I think in a lot of ways, could have counted me twice, not just one in 16.1 million, but 2 maybe in 16.1 million Americans. The Alzheimer's Association Facts and Figures report says that's how many Americans are providing unpaid care for people with Alzheimer's disease and related dementias. These caregivers provide an estimated 18.4 billion hours of care valued at over $232 billion. 85% of care is provided by unpaid caregivers. Those are family members, friends, loved ones. And these numbers are even updated. I saw that it was already put in the chat to look at the Alzheimer's Association Facts and Figures report from 2020. This is an incredibly rich document with stats and figures and information about our community of individuals and their loved ones living with Alzheimer's and related dementias. But I share these numbers with you because we really need to take a moment to acknowledge the hours, the value. This is only the monetary value of the care that we provide. For many of us, you could never put a price tag on our role as caregiver to care and love and provide support and protection for our family members during probably one of the most vulnerable times in their lives. But it is something as a society that we need to think about. And we need to think about, how can you achieve this task? How can you get this work done? Can you do it by yourself? I would argue no. It takes a village to raise a child, and I would say it takes a community to care for someone living with a dementia. So I like to think about the caregiver trifecta. And I want to just spend a couple of moments sharing with you this idea that I've come up with and seen over time about how you can match support from the medical community, your disease community, and your home community to be successful in your caregiving experience. So if we think about that trifecta, all focused on the person living with a diagnosis and their care partners. So, medical community. This is about really finding medical experts that have explicit experience and expertise in your loved one's diagnosis. So, if you're living with Alzheimer's disease, frontal temporal dementia, primary progressive aphasia, supranuclear palsy, Lewy body dementia, cortical basal degeneration, if you are living with a condition that causes dementia, you want to be with a medical provider that truly understands your condition so that you can receive personalized education, which will help you better understand treatment options and where you can be partners for care planning. It makes a big difference and can even provide opportunities to participate in research, which for many of us is our power play against these diseases that want to take a hold of our lives. Being connected with your disease community can be really empowering because you may feel like you're the only one that you know who's living with Lewy body dementia, primary progressive aphasia, frontal temporal dementia. That isolation and loneliness is something that we have a cure for right now, right? So I want to encourage all of you, if you have not yet connected with the disease organization for your diagnosis, reach out today. And I want everyone to remember that the Alzheimer's Association, their full official title is the Alzheimer's and Related Dementia Association. If they're the organization in your community and you're living with Lewy body dementia, FTD, or a related condition, call them up. They want to provide care and support to you. Oops. Home community. I had a party in my yard. We had 140 people because I wanted to launch an education and awareness campaign about frontal temporal dementia, caregiving, and taking the power back from rare disease. It's called Love is Out There. You can learn more about it if you go to my website, katiebrandt.org. And I will say that the day before the party, in a panic, I ordered extra porta toilies because I thought, I've never had 140 people in my house before. But this is just really an example of where does care happen? Where are you going to get the most help and support? In your home community. So this is, of course, family, friends, neighbors, loved ones, but it's also your senior center, the adult day health program in your community, your memory care assisted living, skilled nursing facility, home care agencies. Reach out to elder law attorneys, life care managers. These are the folks that are going to help you develop a person-centered care plan that reflects your values and your desires. If you're living with a diagnosis, talk with your loved ones as much as you can about this. If you're a care partner and your loved one can't speak for themselves, think about their values and your values and make that care plan with a team of professionals, especially working with an elder law attorney and a financial planner to help you think about what's possible and what you may need. Plan for the unexpected. So my takeaway for the Caregiver Trifecta is that I want you to identify, work with an interdisciplinary medical team to help you really understand what you're dealing with so you can make plans for the future. Protect, find an elder law attorney, a financial aid planner to help you make a care plan that can protect not only your assets, your home, but also your values and your goals of care. And then I want you to build a team, engage with local service providers, connect with friends and families so that you can identify what is the care and support that you need. Self-care is incredibly important. We know that being a caregiver to an individual living with dementia is a threat to your health. Dementia caregivers have higher healthcare costs than non-caregivers. And we have some data here from the Alzheimer's Association Facts and Figures report where we see that caregivers are rating their stress as high or very high. Caregivers for people living with dementia suffer from depression at higher rates from other caregivers, and that they're somewhat concerned or very concerned about their own health. What we want to think about is that care and support for care partners is care and support for individuals living with a diagnosis. when there's more gas in your tank, when there's more oxygen flowing through, we all know the analogy when you're on a plane, they ask you to put on your own mask, your own oxygen mask, before you would put on the mask of the person sitting next to you. When you have been able to sleep and rest and take care of your own health, you are going to be a better care partner, advocate, and support to your loved one living with a diagnosis. So self-care is incredibly important. When I think about my role as co-chair of the NAPA Advisory Council, I just wanted to share with you that we do have a national plan to address Alzheimer's disease. Some of you may remember when President Obama said that we were going to learn how to prevent and effectively treat Alzheimer's disease by 2025. Well, we might not be there yet. We're on our way. And that proclamation launched the National Alzheimer's Project Act. It developed the National Alzheimer's Plan, and then that created the council, where we're working to optimize care quality and efficiency in care, to expand supports for people with Alzheimer's and related dementias in their family, to enhance public awareness. Because when you think about how I had to take my husband to 8 different physicians to figure out what was going on in his brain, increased public awareness can help us get to those accurate diagnoses sooner. And then, of course, we want to track progress for research and care and drive improvement. I had the honor of interviewing Dr. Anthony Fauci, the director of the National Institute on Allergy and Infectious Diseases. I interviewed him this January, the day before the presidential inauguration, because I wanted him to speak directly to our Alzheimer's and related dementia community about the impact of COVID, and specifically the COVID vaccine. So we'll put it in the chat and send out the link, but you can see that 15-minute interview on the MGH-FTD unit YouTube channel. But one thing that I thought was really poignant was he said that the speed of the vaccine is purely a reflection of the extraordinary scientific advances in vaccine platform technology that have occurred and allowed us to do things in months that normally would have taken years. And when I think about all the families living with Alzheimer's and related dementia and the work that we're doing, the passion, the drive, the dedication, it would be incredible to think about what can we all do together to move the needle forward for care and a cure for Alzheimer's. Just bumped my slide. But here's just a picture of my dad and my son, Noah. As you can see, COVID did not allow us to get a haircut, but this was their first hug in August, right? Since shutdown in March, dressed in full PPE. And my dad is currently living in a memory care program. We used to see Dad multiple times a week, go out to dinner, spend time together, go to doctor's appointments together, just grab a coffee, go for a walk. And it has been incredibly hard to be physically separated. We know that the impact of COVID-19, social isolation has impacted those living with dementia as well as their care partners and family. We know that we've seen more cognitive decline as folks have been separated from their loved ones, their ability to connect with therapists and their providers early on in the pandemic. And we know that individuals living with dementia in congregate settings, such as those skilled nursing facilities, were at an increased risk of catching COVID when it was in those close quarters. And then we know that individuals living with dementia are at an increased risk to have worse symptoms and increased complications and even death from COVID-19. So this is incredibly important that as a community, we address those increased risks and needs for our population. And the importance of resilience. We've seen that resilience in families, but also in the incredible workers who provide home care, memory care, and skilled nursing services. And I just want to take a moment to thank all of those professionals who work in the industry of care, providing that professional care and support, but also real love to individuals who could not be with their family members during the pandemic. And so I just want to thank all of them at this time. Mike passed away on April 19th, 2012, at the age of 33. Just over 3 years after his diagnosis, 21 days after our son Noah turned 4, and only months before we might have celebrated a decade of marriage. Mike lost the ability to speak, walk, and swallow, but he never lost his voice. As Mike's wife, I was his biggest advocate, and I continue that advocacy today in honor of Mike and in support of families walking the journey of dementia today. This was an ad that ran in the Washington Post for International Rare Disease Day, the year after Mike died. And I started doing volunteer work and advocacy in the Alzheimer's and related dementia space because I didn't want FTD to have the final word in Mike's life or in our family's story. And I've dedicated my professional career to this work because I needed a place to put the energy that the grief of losing Mike and having dementia come into our lives had created. It's been healing for me in a lot of ways. And I think also helped me to cope and really just understand what had happened. And as I leave us today, before I leave my talk, I'll be hanging around for the whole symposium, thanks to invitations from Carol and Sarah. But I just wanted to talk for a moment about resilience. So in my caregiving journey, I happened to pick up this book, Super Survivors, written by two therapists, David B. Feldman and Lee Daniel Kravitz. These were therapists who were working with trauma survivors. And they found that some folks would experience trauma and forever be negatively impacted by it. Others would experience trauma and they were able to kind of bounce back. And then there was this group that were able to sort of bounce forward. People who had real resilience in the face of trauma. And they related these folks to the origin story of superheroes. And they talked a lot about how every superhero story starts from a place of trauma. Superman's home planet is being blown up. Wonder Woman has to leave her community to save the world from war. Spider-Man is bitten by a radioactive spider. Batman loses his parents to violence. And what they said about those superheroes is that the experience of trauma launched them into a space where they had the opportunity to recognize strengths and skills that they didn't know they had. And so here is a picture of Noah. I asked him to dress up in one of his superhero costumes so I could get some photos for my presentation. He was very willing. But the superhero story has been a way to talk with him about what happened to us and to really think more about, even though this difficult thing happened to us, what are we able to learn from it? Joy is going to be essential for resilience, strength. I love this quote from the book that super survival isn't a magic bullet that makes everything instantly better. In a way, life is a constant process of super survival, of facing life's seemingly impossible choices with honesty and faith in ourselves. It's a capacity all of us share. It's the capacity to hope. Recognizing yourself as a superhero, saying that you're resilient doesn't mean that you get it right all the time. It doesn't mean that you wake up feeling amazing every day. It doesn't even mean you can be a superhero every day. Here you'll see Noah's taken off his mask because it is not only my responsibility, but my privilege to say to him that he doesn't have to be a superhero all the time. As his mom, as his parent, I have the right and the privilege to do that. And what I've noticed with caregivers is that they need someone in their corner who can tell them, hey, it's okay to take off your cape for a while. You lay on the couch and eat this ice cream. I'm going to do the caregiving today. So it's this balance between finding our strength and recognizing and being open to joy, but also reaching out and saying we need help. These are just pictures, I think a lot about how events with sequins and swag and music provide opportunities for connections and new experiences of joy. for us to raise awareness, funds, and hope that the cure of tomorrow is not so far from the care of today. And it's a way for us all to come together as a community and know that we're not alone, to raise our voices, that we want that help and support now, because we know that the future can be different. I want to thank all of you for welcoming me to the symposium today. I hope I've been close to my time, and I'm so appreciative of the opportunity to be with all of you. Thank you for everything that you're doing.
Katie, thank you for sharing your difficult, but in such a beautiful way, your life story and your strength and resilience and superhero in all of this. I'm just waiting for the chat box, but I love how you talk about the care for today and, you know, it's a hope for the cure for tomorrow. I think that's such a powerful statement and really what we're here together today for. I have a couple of questions that people sent in prior to as they were registering that I think I'd like to pose to you, Katie. One of the questions is a little bit what you talked about in terms of getting help, and often caregivers find it difficult to ask for help. How were you able to do that?
I think with real encouragement from people around me, but also I thought a lot about my goals of care. So one of the things that I needed to do was I needed to find a skilled nursing facility to help me care for my husband, because I realized that when I was focusing so much on laundry and medication and engagement and cooking, that it wasn't leaving a lot of time for that precious family time. And I was so burnt out from doing all of the tasks of caregiving that I couldn't do the thing that only I could do. So I could ask someone to help me with laundry and medication, but I was the only one who could be Mike's wife and Noah's mom. And so when we were able to have Mike live in a skilled nursing facility, the staff there helped me. It was one of our goals of care, family time. And when I would bring Noah, they would assign a staff person to help us have a visit together as a family. So I think I was able to ask for help in that way because it allowed me to achieve a goal of care and one of my values about wanting to have family time. So when I work with families, I ask them, think about your values. What's the most important thing to you? And if you're not achieving it, what's standing in your way? And can we get some help to help knock down those roadblocks?
Thank you. That's very helpful. I see a couple of questions related to FTD in the question and answer, Katie, that if I could pose to you. You talked about 8 physicians and finally a diagnosis. And so there's a question about how it was diagnosed finally. And then just another question in the same vein about whether traumatic brain injuries are risk factors for FTD.
Okay, so just so everyone remembers, I'm not a clinician, but I do work as part of a clinical research team. And when a patient comes into our clinic with a suspected diagnosis or question, do they have FTD? Really, our team works as detectives. So we take a very detailed patient history. So that could come from the individual with the symptoms and also care partners. We use brain images. The physician may order lab work. So that could be blood work, spinal fluid. And then they'll do testing, often paper and pencil neuropsych testing, and put all of that information together to present a picture of that individual. And that will help determine what exactly the clinician thinks their diagnosis is. So for FTD, it's not like you could take one blood test and know for sure. It's often this process. And that's why working with an expert provider who's had experience can be very helpful. Related to traumatic brain injury, so as a non-clinician, the best thing I can say about that is that the type of dementia that you get from traumatic brain injury, that chronic traumatic encephalopathy, CTE, is caused by something different than FTD. So FTD is a progressive neurological disorder that's caused by something that happens in your brain. Whereas chronic traumatic encephalopathy, traumatic brain injury, comes from experiencing a brain injury, something that happens outside. That would be my lay answer, Carol.
Okay, I think it's a great lay answer, and a great, actually beyond that, from all your experience with your multi-professional team. One question, since you talked a bit about COVID-19, but just from your experience as the caregiver specialist in the FTD clinic, can you talk a little bit about the challenges, but the resilience you've seen in family caregivers over the past month past year, related to the pandemic?
Well, the first challenge is that many of our caregivers lost their supports almost overnight. You know, their loved ones were going to adult day health programs 5 days a week. They had care providers coming in. Maybe they had friends who were willing to take their loved one for a walk or out for a cup of coffee. And all of a sudden, they found themselves incredibly isolated. And even it was difficult to go to the grocery store because maybe their loved one couldn't follow the new guidelines to wear a mask, you know, wash their hands, not touch other people. So the resilience that I saw is that people figured out new ways to get things done. I mean, I have been just blown away by the ways that folks have been able to work and caregive. I have one caregiver who she talked about, her husband loves snacks. And so the way she would get through a webinar is she would give him like one part of a banana, he would do a lap around the house, and then she'd give him another part. And that could keep him busy while she did an entire webinar with her team. But really, it's also that they've been able to reach out and ask for help in different ways. So those caregiver supports, maybe the person who used to come and take their loved one for a walk, now they go to the grocery store for them. So it's about having the strength to say, I need help.
Thank you so much. There's other questions in the Q&A, but I think we will send responses. We'll also connect you with some of those questions, Katie, over email, if that's all right.
Sure.
So thank you so much for such a wonderful